Hi, my name's Anita Saltmarche, and I'm delighted to be with you at Synchrony 2020. I'm going to talk to you about photobiomodulation devices or light therapy devices. And to do that, I'm just going to bring up my screen and share that with you. Okay. So we're going to look at light therapy devices that are specifically used for neurologic applications. And we are going to talk about lasers as well as LEDs and some of the differences. A bit of terminology before we start, and you've heard these terms throughout the three presentations prior to mine. A photon is a particle of light and has both wave as well as particle properties. A wavelength, and we've talked a lot about that, is 1/1000th of a meter, and we will focus on visible red and infrared wavelengths. And power, we can talk about that in watts or milliwatts. And for photobiomodulation and light therapy, most frequently we're going to be talking about milliwatts of energy. And if we're talking about a single diode laser, as is demonstrated here, usually 500 milliwatts or less, whereas if we're talking about an application with multiple diodes, then we could be talking about a watt or 1.5 watts of energy, but it's delivered over a much larger area. So within the electromagnetic spectrum, we're talking about visible light, which is here, and we will focus on visible red, and in this domain here, near infrared energy. So visible red is within the spectrum of 600 to 700 nanometers. And we used to believe that it was really best applied for superficial application because it penetrated about a half a centimeter with direct penetration. So it was very good for wound healing and superficial target tissue. But we now understand that visible red energy can also be absorbed by blood and therefore take that energy throughout the body, and we can achieve a systemic effect. And we'll talk a little bit more about that later. And with the near infrared energy, we're talking about not only delivering that energy at a superficial and moderate level, but also deeper up to about 2 centimeters in direct penetration. So it's excellent for musculoskeletal as well as transcranial applications. Some of the terminology we'll be using, and you've heard this frequently throughout the presentations, but just wanted to review this quickly because it specifically relates to equipment and what we'll be talking about there as well. So a joule is a unit of work energy, and we often talk when we're talking about a dose or the amount of energy for LED technology or treatments, a joule of energy being delivered. On the other hand, when we're talking about a more focused point, a centimeter squared, then we're often talking about joules per centimeter squared. And when we use the term power, we could be talking about watts or milliwatts. And most often for light therapy, we're talking about milliwatts of energy. And if it's a single diode, it's usually within that 500 milliwatts. So if I were giving you an example of a 500 milliwatt laser, it could deliver a joule in just over 2 seconds. On the other hand, if I only have a 5 milliwatt laser diode that I'm using, it's going to take me 3 minutes and 24 seconds to deliver the same amount of energy. So the power is important. When we think about lasers, quite often we think about people who have talked about having laser surgery or cataract surgery, and those are high-powered or hot lasers. And those lasers will deliver over 2 watts of energy and will heat the tissue over 50 degrees Celsius. And that amount of energy will cut, vaporize, and coagulate tissues. Whereas a cold or low-level laser or light therapy is minimal heating, and we're talking about milliwatts of energy, and it has a therapeutic effect, not a surgical effect. Similar to photosynthesis as in plants, but our cells are able to absorb that energy. And when we talk about lasers versus LEDs, we're talking about lasers that are coherent and monochromatic, so one color, and they're in phase. And so there is the potential of eye damage with a laser. Whereas with an SLD or an LED, light emitting diode, that wavelength is slightly out of phase and non-coherent, so has no ability to cause any potential eye damage. Years ago, we used to think you had to have a laser to really have the effect on tissue. And we now realize from the research and clinical experience that LEDs can be as effective as lasers can be, especially in transcranial treatments. So if we look at a laser beam and you think about that very focused, collimated beam, very narrow, whereas we talk about an LED beam, much more diverse, divergent beam, and that beam is spread out, which can be quite beneficial if you are using a cluster that has multiple diodes and you have a more even distribution of light energy. Now, when we deliver that energy, quite often I've heard people say, well, if 4 joules will work, then 10 joules should be even better. But there is a threshold, and we know that we need a sufficient, but a weak amount of energy will actually stimulate cellular effects. And when we go beyond that point, we start to see an inhibitory factor and actually maybe the exact opposite response that we're looking for. So the amount of energy and power being delivered is important. So ultimately what we're looking for is a treatment response, and that occurs over usually multiple treatments where there's a cumulative effect that's going on. And so you're building on the treatment that you had 1 or 2 days ago because there's still an effect within the system. And if we need to, we can gradually increase that dose to achieve the effect that we're after. On the other hand, we don't want that inhibitory or overstimulation in an area, especially if we're talking about a chronic condition where we can almost put it into a subacute condition and we can actually exacerbate or increase the symptoms that we're trying to treat. Thankfully, if we decrease the power or stop the treatment for a while, it's a transient effect, may last a few hours or over a few days, but it's not permanent. It is transient. Now, when you're looking at equipment and making a decision about whether or not you should purchase one device over another, some of the things you should be looking for are regulatory clearances and where and how those devices are being manufactured. In the US, we're looking for FDA clearance for a medical device, unless it's a wellness device, and then it doesn't have to have a clearance. But a clearance allows a manufacturer to talk about a specific indication of use that it can treat. And in Canada, we have Health Canada licensing for medical devices. And then it's important to understand where are those devices being manufactured and the country, as well as whether or not they're being manufactured in ISO 13485, which just means that they have quality systems for manufacturing medical devices. It's now MedSAP. And in Europe, that regulatory approval would be through EU mark. Now, there are different ways of delivering energy. We can hover a light above the area we're treating and never make direct contact, but you'll see from this diagram that you have much less depth of penetration. Or you can make direct contact, and then you get greater depth of penetration. And if there's slight pressure put over the area, especially if you're talking about treating over a muscle, then you'll get greater depth of penetration of that light energy into the tissue. This is going to be important because devices may make direct contact when we're doing transcranial or other forms of treatment, or they may hover over the area. But keep in mind, when that's done, you're not getting the same depth of penetration and therefore generally effectiveness. So how do we deliver that energy? It can be done in 4 different ways. Because we're focusing on neurologic conditions, most often we're going to talk about transcranial, so directly on the head to treat the brain, which means it has to go through the hair, scalp, skull, dura, and into hopefully the target tissue we're after in the brain. Transcranial indirect treatment is still treating the head, but again, we're holding that device away from making direct contact, and we're not going to have the same depth of penetration. We can also achieve having neurologic effects with the use of light energy by treating intranasally. And that way we can stimulate the olfactory bulb, which in turn should stimulate, or what we're after is treating the hippocampus. And that can also, depending on the wavelength, have a systemic effect. So if we're using infrared, we're treating or directing that energy more at the brain. But if we're using an intranasal device that's visible red, then we are seeing or achieving more of a whole body or systemic effect. And then we have a new approach, which is literally a whole body approach. And the patient lies on a therapeutic light bed, and it's closed. And you'll see some examples of that, and the entire body is treated. There is less research in that area that I'm aware of related to neurologic conditions, but certainly from a performance perspective and for chronic pain and other conditions, it's proven to be quite effective. So let's look at some of the devices that can be used. And this picture actually comes from one of Dr. Margaret Nazar's studies. And what we're looking at here are these clusters, which look like they're all visible red, but in fact are a combination of visible red and infrared. And they're held in place with a light mesh stocking. And so they're put in specific locations that we are treating on the brain. And we know from functional MRI and the research that you've heard previously, we can see changes directly under those areas that are being treated. Another example of this in a much larger area, this is a Thor helmet, and you can see the inside. There are a number of clusters with LEDs, and they can be either a combination of visible red or infrared. And this helmet, I believe now, other than for Dr. Nazar's research study, treats the entire brain all at once. So we're going to get that depth of penetration. It's sitting on the skull. Another example of that, a more flexible approach. And let me just talk about the Thor research helmet is about $40,000. So not very attainable, and it's quite heavy for home use. But this is another version where we get that direct contact. It's flexible cloth on the outside, and it's about $1,100, and that's by Pro Neuro, and it's a light helmet or treatment for transcranial. I personally have not used this, so I don't know, but the fact that light does have a byproduct of heat, I don't know how much heat is actually generated under that, but it is an interesting device for transcranial. Now, here's another version. Rather than covering the entire head, is using a head frame, and this one happens to be by B-Light, and you'll see there are selected locations, and Dr. Nazer has talked about this in her research, and so you know a bit about this, but this is a combination of transcranial as well as intranasal, and this is exclusively infrared energy that is being used. Now, this is another device actually originally developed in Australia. And this was for Parkinson's research. And they were trying to make a device that was literally do it yourself. And this is the CalTech, and it's a number of LEDs on strings and put together either in, the later version, it was just wrapped, and then the later version is Elias. They've actually done a fair amount of research with this device and had very good outcomes with Parkinson's. And so this was really a homegrown effort and research, and they've gone on to develop other devices. This particular device, which is another form of helmet called the coronet, and you can see this placed on the head, is can be either visible red and infrared or just infrared, and it is $750 US. Now, this is a different type. This is an indirect. So this isn't making direct contact, but you can see light energy that is being delivered around the head to have a similar impact. This device can actually be put on the face or focused on the head. And a similar, again, indirect transmission with visible red and infrared, and you can put your head under here, and that can transmit light. Again, I have not seen specific research using that device or the previous one, so I can't comment, but these are examples of other devices out there. Then another way of delivering energy is through the nose. And the reason for using visible red energy to do that is that it can be absorbed by the blood and taken throughout the system. The infrared will be more directed at the brain. And this is another version. This is the ProNeuro intranasal device, and it's a combination of visible red and infrared, and it's treated simultaneously in both nostrils, and that's about $1,000. Now, there are other devices. It's really quite exciting to see really the explosion out there and research going on. This is the Nerex brain pacer, and you'll see this wraps around the forehead and onto different areas of the brain. This is just a research device at this point in time and not available to the public yet, but they're doing extensive research to look at its impact on enhancing cognitive functioning. So it'll be exciting, certainly be attainable once the research is done. So it'll be exciting to see what the results are when that's finished. And another version of this, which is the Cognilume, it is a device that is specifically being developed by a group out of the US, out of New York. And this device will be in clinical trial, and it will be used on children between the ages of 2 and 10 with autism spectrum disorder. So we're quite excited that study is just starting to see what the results will be with that. And it gives you an idea of how far forward we're moving and how quickly with new devices. So it's pretty exciting. Then we talked about whole body, where the patient literally lies and is encapsulated, and the whole body is treated most often with visible red and infrared, and this happens to be the Da Vinci whole body light therapy system. And there are others, another one by Theralite, and again, that full body visible red and infrared. And this is really the premier in this whole group, the Nova Thor, and it's a whole body red light, although they call it red light therapy, and I'm seeing that more and more. In fact, most often red light therapy is a combination of visible red and infrared. Now, some of these whole body devices are $90,000 to $150,000. So they're not for home use for many, but there's certainly clinics around the US and in Canada now that are offering these treatments. So when we're talking about light therapy and contraindications, it's important that we look at, if you're using a laser, especially even a 5 milliwatt laser, that you would never focus it into the eye. Some clinicians say that we shouldn't be treating over the thyroid gland. And the thought there is that's where we store iodine, and that may accumulate more light in that area. We don't treat over areas with recent hemorrhage, and that's important if we're looking at any sort of condition of the brain where there's been a recent hemorrhage. We don't treat over, which would be less important. We're not going to see this most often in any sort of transcranial treatment, but we don't treat over an area that's recently been injected with steroids or Botox. And we don't treat directly on unclosed fontanelles of infants and very young children, usually up to about 1.5 years, because it may in fact enhance or hasten the closing of the fontanelles. And we don't treat directly over cancerous tumors unless you're working with an oncologist. So in conclusion, it's really an exciting area. You've heard about incredibly positive research and clinical experience, and it certainly supports the safe and non-invasive but effective use of light therapy for a range of neurologic conditions. In my practice of over 20 years now, both clinically and research, I've never seen significant negative consequence with either transcranial or intranasal. There's a huge array of devices out there, which on one hand is extremely exciting. On the other hand, there are many different ways of delivering that energy and different devices. Some of the companies that I contacted wouldn't give out or didn't even know how much power was actually being delivered. So that has to raise questions about whether or not those devices should even be considered. And I think ultimately, for the best results, seek out clinical expertise in the selection of the device for your treatment protocols and coaching along the way of your healing journey. Thank you. And if I can be of assistance, please let me know. And I think we have time for questions. So I will finish my presentation now. Thank you. Okay, so there are a number of questions. I know we are a little over time. I was just waiting to see in our chat box if we were okay to go ahead. Yes, there's one here, and I'll put it out to the group then. It's asking if we had to make a selection of different devices that we would use for treating autism spectrum disorder, what would our suggestions be? And I'll put that out to both Paolo and Marnie, if you have any thoughts on that.
I'll just say it's going to depend on the age that you're working with. I think Paolo's going to chime in on that. So I guess we don't have in the chat notes what age we're working with, but I'm thinking that if you're working with a very young child, Anita, you have experience with this with Down syndrome with your Medix Health LED cluster heads. Otherwise, the Cognilum cap is also a possibility. You might comment on that, or Paolo's welcome to chime in.
Yes, so I know that MGH will be using the Nerex brain pacer. So that is for 5 years or older. So it absolutely depends on age, because of course then you have LEDs going beyond, I should say, the forehead, and also you wouldn't be able to have that direct contact if the device is too loose. I agree with Marnie.
Yes, and certainly my experience has been when we have a rigid head frame. I mean, the V-Light has been very good for many different conditions, but because of the size of the head frame, again, we're running, right now there hasn't been a focus. That may be something we need to start looking at other than the Cognilum, which it will be going into clinical trial and not available right away, but hopefully sometime in 2021, depending on how quickly they can recruit.
And they're working with 2-year-old children, I think. They're very, very young.
Yeah.
I will comment that the default mode network itself is not really even partially together until age 4. And then there's a lot of increased connectivity that goes from 5 to 13 years of age. So it really makes a difference. And then in autism spectrum, you know, there's such weak connections, even in young adults, of the default mode network. So you just put together your goal. But if language is your goal, you really want to work, I think, with your Medix Health LED cluster heads, because you can put them where you need them. Yeah.
Yes.
So it's in that protocol I talk.
I think the flexibility of having something you can move around in young children, and we've seen very good results with the language protocol, Marnie, that you developed. So yes, that's but having the ability to move that, I think, does at this point in time make a difference. So
I would think that the intranasal devices should be fairly practical, assuming that the child is okay with keeping it. I don't know what's your experience, Anita. Have you tried intranasal with children?
I have, and unfortunately, most of the intranasal diodes are too large for many children's nostrils. So being able to use them much before maybe 10 or 11. And then there's the whole issue of initially, I may start with the transcranial, and as behavior sort of calms down and things settle in, then introduce the intranasal. I'm actually working with a group right now, trying to see if we can't do earbuds, because there has been some preliminary research to look at whether or not delivering the energy this way, if people are either unable with the devices we have. And I know most of the research has been done looking at really seasonal affective disorders more than anything, because the buds that are out there right now with light are broad spectrum rather than just infrared, or maybe infrared and visible. But yes, so I think there are some different ways we may be able to deliver that energy in creative ways so that we can bring about these positive events. And I also...
Oh, okay. I just want to quickly mention that age 11 years is an age that a medical doctor in New York told me he works with teenagers and children who have TBI. And he uses the V-Light gamma or alpha with those, and it is a rigid head structure, you know how it goes over the head with placements, but it's age 11 and up that he uses that device with in children.
Yes, yes. And it's really based on the circumference of the head. So it's disappointing as well as difficult if they end up purchasing devices that don't fit and then have to go back and start all over again. So I usually have them just do circumference of the head to make a decision about whether or not, at least with the V light, I know what that is going to look like. Although, you know, as we're seeing, there are new devices. There are also a couple new devices coming out of Australia, probably in the first or second month of 2021. So there really, I think the innovation is just starting in the area because we have seen the safety and effectiveness of light therapy across many different neurologic conditions.